Hi, this is Dr. Bajwa from Buena Vista Optometry in Ventura, California, and I wanted to talk to you today briefly about diabetes. Approximately 30 million Americans, or about 11% of the population, unfortunately, between the age of 20 and 79, suffer from diabetes. 90% of those individuals have type 2 diabetes, which is a disease where the pancreas either is not responding enough by producing enough insulin, or the body has become resistant to insulin. Both can unfortunately lead to complications, not only overall in the body, but particularly for your eyes. The people that we talk about who are at highest risk for having this are people that have had the disease for a longer period of time. Unfortunately for our Hispanic population, if you've had the disease type 1 or type 2 for 15 years or more, you're at about a 3 times higher risk for diabetic retinopathy or complications in the back of your eye. Unfortunately, we also know that our Pacific Islanders, Native Americans, and African American population is also at a higher risk for developing diabetes. Now, when we talk about diabetes, it can actually lead to about anywhere between 12 and 24,000 cases of blindness per year due to complications of the eye related to diabetes. Among some of the symptoms you may experience if you're suffering from diabetes include a variety of things, but primarily floaters in your vision, spots that you may see. You can also have fluctuations in your vision where things are clear and then blurry over the course of the day or the week. Some patients report shadows in their vision, blurred or distorted vision, sometimes double vision or eye pain, and of course glare caused by cataracts related to diabetes. When we talk about the complications that we see when you come in for your annual comprehensive eye exam for a diabetic patient, when the blood sugar changes, we can start to see leakage of blood into the back of the eye. We see deposits of blood and blood protein, and we can also see swollen areas of the retina that correlate with a lack of oxygen coming to those tissues. If this is happening, and it's happening on a chronic basis, there will be structural changes to the eye. Of the most serious form, we talk about diabetic macular edema. And this is in the very central portion of your retina, the area called the macula. You think of it like your bullseye. That area can start to swell due to some of the changes due to diabetes. And the tricky thing about this is, from a patient's perspective, you may not really notice very much of a change in your vision. When you come in and you see your optometrist for a dilated diabetic eye exam, we can see changes that might indicate that there's potential threat to your vision that may lead to blindness. Beyond that, when we talk about extensive amounts of bleeding that occur in the back of your eye, it can put you at risk for developing new blood vessels, which is what we call proliferative diabetic retinopathy. Those new blood vessels unfortunately tend to leak even more. They can leak into the vitreous or the jelly part of your eye, leading to a hemorrhage that can really affect your vision. It can also lead to a retinal detachment by pulling the retina off the back of the eye, also leading to permanent blindness. As this continues to occur, we can get more of those new blood vessels starting to form in the front portion of your eye. When they start to form towards the front of your eye near your iris, we can see that there's a higher risk for developing neovascular glaucoma, or a type of glaucoma related to diabetes. All of these things can potentially be prevented or at least minimized when you come in for your annual comprehensive eye exam. It's one of the things that we really stress for all of our patients, even well-controlled type 1 or type 2 diabetics. They should come in on a yearly basis to see their eye care specialist, like an optometrist, to have a comprehensive eye exam to make sure that any of these complications, if found, can be relayed to your doctor and tighter blood sugar control can possibly be achieved. When your body gets a little bit better control of its blood sugar, all of those changes that we talked about, if caught early on, can regress and go away and keep you with good functional vision. Again, this is Dr. Bajwa from Buena Vista Optometry in Ventura, California. If you have any questions that you would like answered, please feel free to reach out on our website or on Twitter at Dr. Rajbaj with the hashtag AskAnEyeDoc. Look forward to talking to you again soon. Bye-bye.